Hi again, this is Anil here at DiCarmel International Trainers, the expert NCLEX trainer. So let us come into another favorite NCLEX topic for the day, which is autoimmune disorders. Okay, what are autoimmune disorders? Okay. I'm sure you come across a lot of topics, where we hear this term autoimmune disorders. And a lot of times I ask students, what is autoimmune disorders? And the very common response I get from most of the students, do you know what it is? They say, all right, it's a state of immunosuppression. Well, in my understanding, that's not right. So let's try to understand it a little bit more closer. I mean, first of all, autoimmune disorders, it is not immunosuppression, it is a hyperimmune response. Like our body starts to produce antibodies against our own cells or our own body tissues. And to understand that closely, let me try to explain what happened in a normal infection process. I mean, imagine a foreign body, maybe a bacteria, maybe a virus, maybe pollen, dust, something is coming in, right? That's an antigen. When that antigen is coming in, our immune system starts to produce antibodies. So that's a normal immune process. But what happens with the autoimmune disorders, the topic we're going to talk here, so our body produces antibody without a stimuli or without a provocation from outside. Probably there is nothing that is coming from outside. There is no bacteria, no virus. There could be sometimes, for example, sometimes patients following vaccination, they can get an autoimmune response. That is not unusual. But in most cases, there may not be a specific stimuli or an antigen coming from outside. So without that antigen, our body starts to produce antibody by itself. And these antibodies that are being produced, that can attack our own body cells or body tissues. So that's where we start to present with various symptoms. And let's look into a few of these classic conditions. I mean, there are a dozen of favorite classic NCLEX topics, where we will talk about autoimmune response and its management. So if you understand, if you can identify this particular condition is an autoimmune response, you are able to naturally predict the solution for the problem as well. So instead of, you don't have to study multiple sclerosis, as an autoimmune, myasthenia, not totally separately. I mean, they do have their own unique symptoms or unique underlying characteristic or pathophysiology. But regardless of such reasons, they do have something in common. They all are autoimmune disorders. So let us look into this classic list of topics what we have on the screen. I do have a long list, as you can see here. So the first one we have myasthenia gravis, and then there is multiple sclerosis, then there is Guillain-Barré syndrome, then ITP, right, idiopathic thrombocytopenic purpura, Kawasaki disease, SLE, psoriasis, Crohn's, ulcerative colitis, and rheumatoid arthritis, and so on. So again, something common for most of these conditions is they all could be triggered by this autoimmune response. Without no specific reason, body starts to produce abnormal antibody that can destroy our own body tissues. For example, you take the case of the first three, myasthenia gravis, multiple sclerosis, or GBS. In all those conditions, the antibody produced can possibly destroy a part of the myelin sheath. Everyone know what the myelin sheath is, right? That's a covering of the neuron. So it can destroy the myelin sheath at various locations. It could be the CNS or in the PNS at various locations. It can destroy the myelin sheath. And when myelin sheath get destroyed, it can disturb the normal flow of the impulses from one nerve to the other or from a nerve to the muscle. So that's where this patient may present with a weakness and other common symptoms. Again, we can talk about them specifically as we move forward into those topics. If you understand this much, it will be easy for you to predict the management also in common for these conditions. And I would say what you see on the next page, you can see, there are the two common management we use for most of these conditions. We use one or other immunosuppressive drugs. Or you may have heard about this treatment option called the plasmapheresis. I mean, what are immunosuppressives? Immunosuppressives are drugs that will suppress the immune response. I mean, we heard autoimmune response. It is a hyperimmune response. It's a heightened immune response. So these drugs will suppress that response and control the symptoms. So that's why immunosuppressives are a routine management for most of these conditions, and we're going to talk on that another time in detail as well. Another treatment option we have here is plasmapheresis. You may have heard it is somewhat similar to dialysis. In dialysis, the machine will clear all the waste products from the body, what the kidneys cannot clear. The same way in plasmapheresis, a very similar machine, this will clear the unwanted antibodies that has been generated because of the autoimmune process. So that will again help to control the patient's symptoms. And I hope this new lesson gave you a new understanding of how to approach the NCLEX topics instead of just simple memorization, and do have the deep understanding and then analytical skills. So that will help you eliminate the wrong options very effectively and get into the right option and get through NCLEX much more easily. And thanks for watching DiCarmel NCLEX review program. See you again.